So our goal would be to try and help them to do a quarterly clinic and to especially work with the deworming program, because that's the other thing we saw a lot of is people with worms, and to try and support their plans for having not only a church but a school and a clinic and a feeding program, and to try and educate some of those community members. And this patient was one of Scott's. This is his story really to tell. That this little one actually had pneumonia by clinical exam. He didn't have x-ray at the clinic. And his father was pretty distressed because if you have pneumonia, you die in Haiti. And once he found out that we were doing all the right things with hydration and antibiotics and that we expected his son to live, he was a lot happier and wanted to say thanks to us and wanted to know, how Scott was even able to be there from the U.S. And we talked a lot about the people who were here back home supporting us in this mission. And so as you can see here, that's the thanks from them for letting us be there, because there were a lot of people here, our families and colleagues, as well as people in our different communities who helped in different ways to support the work that we were doing. Last time I did this talk, I had questions from students afterwards about, how do you respond to something like that? And you have to think about the type of disaster that's there, where it's at, the climate, the level of response that's needed, and what resources are needed, and whether you have the ability to meet the needs that are being asked for. There are some global competencies for responding in a disaster. Some of that is trying to understand what command structures are, having knowledge about roles and responsibilities and policies and procedures, being able to recognize an emergency situation on top of the disaster, and being familiar with communication systems and constructs that are there, as well as being able to utilize personal protective equipment and taking health and safety precautions. And there are lots of people who are willing to volunteer. It's important that you be licensed for whatever you're being asked to do and to carry copies of those with you. Researching organizations that you might want to volunteer with. Think about how your responsibilities are going to be covered at home, because the home front has to be cared for when you're away. And what sort of support will you get for airline, for lodging, for meals, and will you be safe in the place that you're going? I have to say I felt very safe where we were at. Not once did I feel that I was not cared for and in a very comforting environment. But self-care, you have to think about yourself as well as a family plan and logistics for here at home. And if your lodging is that you're carrying everything, then you have to be able to carry that with you and care for your own health care needs. And then afterwards, consider the psychological impact, which I think that I got a whole lot more than I gave, and that's what a lot of us talk about when we go and do things like this. Having safety in teams and knowing capabilities, and we had said that a team from UVA, since different groups was asking us, would be a minimum of 2. So we wouldn't send anyone to go with a group if there wasn't at least one other person with them, because there's some comfort in numbers. And then communicating with home. We did use a satellite phone. I think the other team had cell phone coverage where they were, but then also rest before and after the event. And of course, disasters can strike anywhere, so being prepared, both starting with personal preparedness for home, your family, your automobile, what's in your nursing school office. We did a little bit of this last spring with the COOP program at UVA. There is an ARC program that was created by a group of our graduate students that's online that people can use to work in their communities to help them prepare for disasters. And these are the little ones we saw every day at the church. Their mother was actually helping with the feeding program, and they live pretty close by the church. But again, thank you to everyone at UVA that helped work with us. We do have a lot of volunteers who've signed up on the Global Health site, and as we continue to find opportunities for people to work in Haiti, this is where we'll go to for the list of volunteers to try and recruit those people. And we also have set up an account through Nursing Students Without Borders to try and help support some of the airfare and things that are needed for getting medical teams to go in as we work with the Center for Global Health to continue to try and make an impact for the people that are there. Thank you all for being here.